So we've been working on a person-centered decision support for people with IBD, which stands for inflammatory bowel disease. And this is our team. Do you want to present yourself?
So my name is Cecilia.
My name is Perisia.
And my name is Anne. Yeah. So initially we got the following challenge from Karolinska University Hospital, and it's how might we enable patients to become more involved and well informed about their continued care after colon surgery. And after doing some research on the topic, we decided to redefine the challenge based on insights we got from interviews and surveys. So then we said it as how might we create a coherent and person-centered care journey for IBD patients that ensures continuous information, involvement, and support across all stages of care.
And almost the first thing that we did was to create a customer journey map. And before I get into this, I just wanted to state that inflammatory bowel disease is affecting 1% of Sweden's population today. So that means that it's a public health problem and it's emergency growing. So this is the beginning of the customer journey map. So it starts by the patient gets the first symptoms. Maybe they go on sick leave, take over-counter medicine, go to primary care, and this can go somewhat back and forth. And at some point, they may feel a little bit better, but when the symptoms get worse, they need emergency care. And then they end up in specialized care and get a IBD diagnosis. So from here, the treatment can start, and they start by taking medicine and following some diet suggestions. And right now there are 12 medications on the market, and it takes about 3 months to evaluate each medicine. So if one medication doesn't work, you have to try the next medicine, and you get stuck in this kind of loop. But for some patients, they do find the right medication. They can live on that medication. And maybe then for a couple of years, the symptoms come back, and then you have to go and change the medicine. Yeah, it's a process. But for those that don't respond to medicine, get remitted to get a surgery. So the first thing is that they do a first surgery, and then they can choose between 3 options. So they can keep the stoma, connect the rectum, or make a kind of J. It's called a J pouch. And then some patients need medicine after surgery as well, before they can somewhat come back to life and be somewhat asymptomatic.
Nice. And from the interviews that we did 5 interviews, and we also posted a survey where we got 10 responses. And with that also we had reports from Karolinska, who also did about 21 interviews with the patients. And with that we came with 3 personas who represent 3 different stages of patients. And one was from someone from primary care, then the specialized care, then the after surgery, or when the symptoms are already stable and they somehow live and feel better. And in the primary care, it was noted that most patients felt unheard, and they didn't know much about what IBD actually is, and they didn't know the risks that they can have which is to develop cancer if it's not properly treated. And also, in specialized care, most of the patients felt burdened psychologically, and they lacked information to make informed decisions, and also they needed someone they can relate to. And in the after surgery, most patients wanted to know more what IBD is and wanted to be experts themselves. And after that, we identified the problems that are there about the IBD disease, and we categorized them in 3 problems: that there is lack of consistent or individualized information, and also there is no clear information regarding treatment options. So most patients, they have burdens into figuring out what treatment options actually works for them, and sometimes can feel burdened with that or anxious. And also the last problem is that there's insufficient structured support. So there are like Facebook groups, but there's no structure in it, and it can cause misinformation and not safe. And with that, we came with the 5 solutions that we chose, and one solution was Get Together, which was event-based. So patients can meet together and speak with one another and share their stories and actually inspire one another in that sense. And it could be event on anything. It could be a cooking class or just meeting up and doing different activities. And another thing was My IBD Guide, which is a website that has every information that is also individualized. So people can read stories, can understand what IBD is, and get to know different treatment options in it. And also, we came up with GutQuest, which is a simulation game. Someone can view the game and understand different treatment options by visualizing what that actually means in the game. And we came with another solution, which is My IBD Guide, which was a matching system app, which connects different patients together that they can, if it's patients who are kinda with same interests, they can be matched and speak with one another and share each other's stories. And the last one was Impact Loop, which is empowering more feedback and between hospitals and the patients. And also the patients can see if their feedback was beneficial to other patients. And we formulated a decision matrix where we put in 5 different categories on how to decide which one we should go with. And the first one was solution challenge fit, if the solution was really fit for the specific challenge, and the cost effectiveness of that solution, of implementing the solution, and if the maintenance for the solution was low or how it was, and then if it was easy to finish it in the timeline that we had, the 20 weeks, and also if it will make it easy, accessible to all the group or all the categories of the patients. And with that, the highest score was My IBD Guide, and that's what we went forward with.
Yes, so the solution that we came up with was My IBD Guide, which is a digital platform that is person-centered for IBD patients and ensures continuous information, involvement, and support across all stages of care. And it includes these 4 features: a personal journal, a knowledge hub as patient's guide to treatment, patient stories, and matching and chat feature.
Yeah, so the first feature of the website is the personal journal. So this works not like a medical journal, more for the patient themselves to fill in. And it creates this timeline where the patient can visualize big events that have happened in their care journey. And this can also be shared with healthcare professions. So the main goal is to target the problem that we saw, that patient felt that it was annoying for them to always tell their story over and over again when they're meeting new healthcare professionals. So then they can show a picture to their healthcare profession, and then they can get somewhat an overview, so they don't have to recap everything. And the second one is the Knowledge Hub, or the Patient's Guide to Treatment. And this provides guidelines and knowledge about IBD. It could include a treatment options guide on different medication, and like maybe some general articles about what IBD is. But it's also very important to have emotional well-being in this part, because it's a chronic disease. Many patients feel like they are becoming their disease, and it's important to take care of your mental health as well. It will also provide questions for the patient to ask their healthcare professionals.
Yeah, so the third feature is sharing of stories, where patients can both write down their own stories and read other people's stories. And through this, people can get inspired in how to deal with different challenges, and it can reduce the feeling of being alone in the journey. And lastly, the fourth feature would be a matching and chat. So here we could have both a peer matching and a mentor matching, where a peer matching would be two people in a similar position, maybe at the same point of their care journey with similar interests. And it could also be mentor matching, where someone further along in the journey could guide someone who's maybe more new to the diagnosis. And then also a chat feature where people can connect directly with each other. And our target users would mainly be the patients. But we also discussed whether healthcare professionals should be able to get access to the information that the patients put in themselves in the journal, for example.
Yes, and our solution has these three unique values, and that differentiate us or our solution with others. And first of all, is patient-centered. So we ensured that everywhere along the way, we included patients, we interviewed them, and also after having the prototype, we also contacted them to have feedback, and they shared a lot of feedback on how we can improve on that. So we still want to continuously connect with the patients so as we can create something that is better for them. And also the body matching and chat, it's a kind of a new feature that it can create emotional support for the patients that is outside the healthcare system that is there right now. And also we want to empower patient independence so they can help one another. And with that, the impacts that we want to impact in general, it's one, we want to reduce sick leave. So if the patients know what the disease is from early on, they can be diagnosed early, and it can reduce the amount of times that they go in the loop. And also, yeah, as stated in the first impact, is to get diagnosis early, because there's all the information about the disease, what it is, and what to expect. And also, they can find the right treatment, because there is a lot of articles about the treatment options and what side effects, for example, certain medicines take or they can show, so all patients can at least find the right treatment at the right time. And also, we want to reduce the number of healthcare appointments without reducing the quality of care. So if there is appointments that require where patients need more support or some information, that could be replaced with going to our website. And also, we want to reduce anxiety to patients and also family members, because family members are directly affected by what their relatives are going through, so they have to support them. And if the patients have enough support, so it can reduce the anxiety for them as well.
Yeah, so we made a prototype of this website, and then we shared it with patients, or challenge givers, and healthcare workers to get some feedback. And in general, people were very positive, but they also gave us some things that some concerns to think about and improve. And so from the patients, they thought it was maybe too advanced language. They did also have concerns about data safety and a wish to go deeper within the knowledge. And they did also have concerns about if we would attract enough patients to make good matches. They also requested more info about our own organization and company. And the challenge givers suggested a bank ID login for safety, and that patients would get invitations from healthcare professionals, and also more illustrations, and to use guidelines instead of scientific papers. And healthcare workers suggested a chat feature, which we then included, and also that we should become careful with AI and also provide more diet tips.
Yeah, so these are our next steps for the journey. So right now we are still piloting the website. We are trying to really make this work with the help from Karolinska to find a way to found this. And then we want to register a company, and then we are going back to the real implementation, and then we want to expand. So thank you so much for listening to us. The goal with this platform is to be a part of the destigmatization of IBD and to educate people so that we can reduce the time it takes to get the diagnosis. This is more than just a digital platform. This is the solution created by the patient themselves. Thank you.